Hello, I'm Dr. Eric Berg. I want to ask you something personal. When you look in the mirror each morning, what do you really see? You might notice a new wrinkle, a gray hair, or maybe just the familiar face of someone who has lived a full life. But what if I told you that your mirror and your own body could be showing you secret messages? What if the slight redness in your palms, a patch of itchy skin you've been ignoring, or even the way you're carrying weight around your middle isn't just a normal part of getting older? What if these are urgent signals from the one organ you can't live without, an organ that performs over 500 critical functions, yet has no nerve endings to feel pain? I'm talking about your liver. There's a dangerous and pervasive myth in our society, especially among our senior population. The myth is that serious liver disease is something that only happens to lifelong alcoholics. This is one of the most outdated and harmful pieces of medical folklore still in circulation. The reality today, right here in the United States, is that the number one cause of liver disease is not alcohol. It's your diet. It's a condition called non-alcoholic fatty liver disease, or NAFLD, and it's a silent epidemic. It's estimated that up to 100 million Americans have it, and most of them have no idea. Why? Because your liver doesn't complain. It doesn't ache or throb when it's in trouble. Instead, it sends subtle, cryptic warnings to the surface, to your skin, your eyes, and your body. Most doctors, with the best intentions, might miss these clues or treat them as isolated surface-level issues. They might give you a cream for the itch, a cosmetic procedure for the red spots, or tell you to simply lose some weight without explaining the dire situation brewing inside. Today, we're going to change that. We are going to become health detectives. Together, we will uncover the 10 critical warning signs your body is sending you that reveal a struggling fatty liver. More importantly, for each sign, I will give you clear, actionable steps you can start taking today to help your liver heal and regenerate. This information could not only add years to your life, but life to your years. Let's begin with one of the most peculiar signs you might see on your skin, particularly on your chest, back, or shoulders. They're called spider angiomas, or spider veins. Now, you might be thinking of the little spider veins you see on your legs, but these are different. A spider angioma has a central red dot, like the body of a spider, with tiny red blood vessels radiating outwards, like its legs. If you press on the center, it will momentarily turn white and then refill with blood when you release it. Many people, and even many doctors, dismiss these as a simple cosmetic issue or a normal part of aging. They'll tell you it's nothing to worry about. This is a critical mistake. These are not random blemishes. Their appearance is a direct signal of a hormonal imbalance caused by a struggling liver. One of your liver's essential jobs is to act as a filter and processing plant for your hormones, including estrogen. When your liver is clogged with fat, it can't do this job efficiently. As a result, estrogen levels can rise in your body whether you are a man or a woman. This excess estrogen causes the tiny arterioles just beneath your skin to dilate, creating these distinct spider-like patterns. Seeing one or two might not be a major alarm, but if you're noticing several of them popping up, your body is screaming for help. The solution isn't laser removal. That's like painting over a crack in a crumbling foundation. The solution is to address the root cause. You need to support your liver's ability to detoxify estrogen. The most powerful way to do this is by consuming cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, and kale. These vegetables contain a compound called D-indolylmethane, or DIM, which is a potent natural substance that helps your body metabolize and balance estrogen. Just steaming a cup of broccoli sprouts or adding a handful of kale to a smoothie can begin to provide your liver with the tools it needs to do its job. Closely related to this first sign is another one that appears on your hands. I want you to take a look at your palms right now. Are they a uniform color? Or do you notice a distinct blotchy redness, particularly on the lower part of the palm, the fleshy area below the thumb and the little finger. This condition is called palmar erythema. Again, this is often dismissed as dry skin, an allergic reaction to a soap, or just poor circulation. People will spend money on countless lotions and creams trying to fix a problem on the surface that is actually originating deep within their body. Just like the spider angiomas, this redness is primarily caused by that same issue of excess estrogen that a fatty, congested liver can no longer process effectively. The elevated estrogen causes the capillaries in your hands to swell and dilate, leading to that telltale reddish appearance. Think of your liver as the main water treatment plant for your city. If the filters at the plant get clogged with sludge and fat, the water quality throughout the entire city pipeline system suffers. Similarly, when your liver is clogged, the quality of your blood and its hormonal balance is thrown off, and the effects show up in the furthest pipelines of your body, like the palms of your hands. The solution, once again, is not a topical cream. It's to clean the filter. This means you must reduce the load on your liver. Start by eliminating the things that cause the fat buildup in the first place. Sugar, high fructose corn syrup, and refined carbohydrates found in bread, pasta, and cereals. These foods are the primary drivers of fat accumulation in the liver. By replacing them with those cruciferous vegetables we just talked about, along with healthy fats from avocados, olive oil, and nuts, you give your liver the breathing room it needs to start cleaning itself out and restoring its crucial hormone balancing functions. Now, let's talk about the most well-known sign of liver damage. But I want to put it in the proper context because there's a huge misunderstanding about it. I'm referring to jaundice, which is the yellowing of the skin and the whites of the eyes. Most people think this is the first sign of liver trouble. This is absolutely not true. Jaundice is one of the last and most severe signs. It's a sign that your liver is in an advanced state of distress, potentially cirrhosis or even failure. It occurs when the liver can no longer process a substance called bilirubin, a yellow-orange bile pigment. When red blood cells break down, bilirubin is created, and it's the liver's job to clear it out. When the liver fails, this yellow substance backs up into the bloodstream and gets deposited in your skin and eyes, staining them yellow. If you or a loved one ever experience this, it warrants an immediate trip to the doctor. But my goal here today is to prevent you from ever reaching that point. Seeing jaundice is like seeing flames coming out of the windows of your house. We want to detect the smoke detector beeping years before that happens. The earlier signs we've discussed and the ones we are about to discuss are those smoke detectors. They are the whispers from your body, while jaundice is a desperate scream. So, if you're not yellow, do not assume your liver is healthy. The absence of this late-stage sign should give you a sense of opportunity, not a false sense of security. The action step here is one of prevention. It's to take all the other signs seriously and act now, so your liver never gets to this critical tipping point. Let's move on to a symptom that is incredibly common and almost always misdiagnosed: persistent widespread itching. This isn't the kind of itch from a mosquito bite or a dry patch of skin in the winter. This is a deep, frustrating itch, often worse at night, without any obvious rash. You might feel it on your palms, the soles of your feet, or all over your body. Your doctor might prescribe antihistamines or steroid creams, thinking it's an allergy or eczema. But when a fatty liver is the culprit, those treatments will do absolutely nothing. Here's why it happens. Your liver produces bile, a crucial substance for digesting fats. Bile travels through tiny ducts within the liver. When the liver is inflamed and fatty, these ducts can become swollen and constricted, causing the bile to back up. Think of it like a plumbing system in your house getting clogged. The bile salts, which are components of bile, then leak from the liver into your bloodstream. These microscopic bile salt crystals travel through your body and get deposited underneath your skin. It's these tiny sharp crystals that trigger the nerve endings and cause that maddening, relentless itch. It's your body's way of telling you that your internal plumbing is blocked. The solution is to improve your bile flow. One of the best ways to do this is by incorporating bitter foods into your diet. Things like arugula, dandelion greens, radicchio, and even a little bit of lemon juice in your water before a meal can stimulate the liver and gallbladder to produce and release bile more freely, helping to flush out those ducts. Furthermore, a nutrient called choline, found abundantly in egg yolks, yes, the whole egg, is absolutely essential for liver function and fat metabolism. Many seniors are deficient in choline, and this can directly contribute to fat buildup in the liver. So, eating whole eggs can be a powerful therapeutic food for a struggling liver. Before we move on to the next set of signs, which are directly tied to the food you're eating every day and the hormones that control your metabolism, I need to check in with you. I want to make sure this is resonating and providing real value. If you found this information helpful and eye-opening so far, please take a moment and just type the number 1 in the comments below. If it hasn't been useful for you, please type a 0. Your honest feedback is incredibly important and helps me create better content to serve you. All right, let's dive into a sign that reveals the root cause of fatty liver for most Americans: dark, velvety patches of skin. This condition is called acanthosis nigricans. You'll typically find these patches in the folds and creases of your body, on the back of your neck, in your armpits, or in the groin area. The skin may look thickened, almost like velvet, and can have a grayish brown or dark brown color. Most people think this is just a hygiene issue or friction, and they might try scrubbing it away to no avail. This is not dirt. This is a physical billboard on your body advertising one thing: high insulin. Insulin is the hormone that helps your body use sugar from food for energy. When you consistently eat a diet high in sugars, starches, and processed carbohydrates, think bread, soda, cookies, and even fruit juice, your body has to pump out more and more insulin to manage the sugar overload. Over time, your cells become resistant to insulin's signal, like a person who tunes out a constant nagging noise. This is called insulin resistance. In response, your pancreas panics and produces even more insulin, leading to chronically high levels in your blood. These extremely high levels of insulin stimulate your skin cells to grow and multiply abnormally, creating these dark, thick patches. But here's the critical link. Insulin's other job is to tell your body to store fat. And when there's too much insulin, it becomes a one-way street for fat storage, especially in your liver. High insulin is the primary engine driving fat into your liver cells, causing NAFLD. So when you see these patches on your skin, don't just see a cosmetic issue. See a screaming alarm bell for severe insulin resistance and very likely a fatty liver. The solution is not a skin lightening cream. The only solution is to lower your insulin. This is achieved by drastically cutting back on sugar and carbohydrates and implementing a low-carb, healthy fat diet. Intermittent fasting is another powerful tool, as it gives your body a break from producing insulin, allowing your levels to fall and your cells to regain their sensitivity. This leads us directly to our next sign, one that is so common in our country that we've normalized it as a simple consequence of aging, the potbelly or apple shape. Many seniors I consult with, like a gentleman named Robert from Naples, Florida, will pat their belly and say, "Well, Dr. Berg, I've just got my retirement punch." They believe it's an inevitable part of getting older. This is a dangerous misconception. That protruding abdomen is not just a layer of soft, pinchable fat under the skin. It's a sign of a significant accumulation of visceral fat. This is a hard, dense type of fat that packs itself deep within your abdominal cavity, surrounding your vital organs, your intestines, your pancreas, and most importantly, your liver. This visceral fat is metabolically active and incredibly inflammatory. It suffocates your liver, both physically and hormonally, releasing inflammatory signals and fatty acids directly into it, further fueling the fire of NAFLD. Imagine trying to run a marathon while wearing a 30-pound vest and having someone constantly blowing smoke in your face. That's what your liver is experiencing when it's encased in visceral fat. The conventional advice to eat less and move more is often too simplistic and ineffective for visceral fat. Because this type of fat is driven by high insulin, the most effective strategy is the same one we just discussed. Control your insulin levels. When you switch to a diet low in carbohydrates and high in healthy fats and moderate protein, your body is forced to shift from burning sugar for fuel to burning stored fat, and it preferentially targets this dangerous visceral fat first. Measuring your waist to hip ratio is a good way to track your progress. For men, this ratio should ideally be below 0.9, and for women, below 0.85. Reducing that potbelly isn't about vanity, it's about liberating your liver. Here's a very specific sign you might notice around your eyes. They are small, yellowish, and slightly raised bumps or patches, usually on or around the eyelids. This condition is called xanthelasma. Often, a person's first instinct is to see a dermatologist to have them cosmetically removed. But these little yellow deposits are not just a skin problem, they are deposits of cholesterol. Seeing them is a clear indication that your body is having trouble managing cholesterol and lipids, a primary function of a healthy liver. For decades, we were told to fear cholesterol in our food, like eggs and butter. But the truth is, the most significant factor influencing your blood cholesterol profile is how well your liver is functioning. Your liver produces about 80% of the cholesterol in your body. When the liver is fatty and inflamed, its ability to regulate cholesterol production and transport becomes dysfunctional. This can lead to an imbalance where cholesterol gets deposited in places it shouldn't, like the delicate skin around your eyes, or more dangerously, the walls of your arteries. So, xanthelasma is a warning sign of disordered lipid metabolism, which is intrinsically linked to a fatty liver. The solution isn't to go on an extreme low-fat diet, which can often make things worse. The solution is to heal the liver. This involves removing the sugars and refined grains that are causing the liver damage and replacing them with healthy fats. Fats from sources like avocados, extra virgin olive oil, and nuts actually help improve liver function and can support a healthier cholesterol profile. It's about giving your liver the right building materials to do its job correctly, not starving it of the very fats it needs to function. Okay, that was the big section on insulin resistance and its visible signs. I truly hope this is connecting the dots for you in a new way. Let me know how we're doing. A quick one in the comments if this is valuable, or a 0 if it isn't. Your feedback guides me. Thank you. Now we are going to shift to signs that indicate the liver's declining ability to perform its crucial manufacturing and regulatory functions. Let's talk about bruising. Do you find that you bruise very easily? Perhaps you just gently bump into a table and the next day a large dark bruise appears. Or you notice unexplained bruises and have no idea how you got them. It's easy to blame this on thin skin from aging or just being clumsy. However, it can be a serious sign that your liver is in trouble. Your liver is your body's factory for producing most of the proteins needed for blood clotting, known as clotting factors. Think of these factors as the emergency crew that rushes to the site of a broken blood vessel to patch it up and stop the bleeding. When your liver is severely damaged and fatty, its production line for these essential proteins slows down. It can't manufacture enough of them to keep up with demand. As a result, even a minor bump can cause blood to leak from the capillaries under your skin for a longer period before it clots, leading to those large unsightly bruises. This is also closely tied to vitamin K, which is essential for activating these clotting factors. A damaged liver not only produces fewer clotting factors, but also struggles to properly utilize vitamin K. To support this function, you must first and foremost reduce the fat and inflammation in your liver through diet. Additionally, consuming plenty of dark leafy greens like spinach and kale will provide vitamin K1, and incorporating fermented foods like sauerkraut, or taking a high-quality probiotic can help your gut bacteria produce vitamin K2, both of which are crucial for this process. Our next sign involves fluid retention. Have you noticed swelling in your legs, ankles, and feet, especially towards the end of the day? This is called edema. You might press your thumb into your shin, and when you remove it, an indentation remains for a few seconds. Many things can cause edema, including heart or kidney problems, so it's always important to get it checked out. But very often, it is a sign of a failing liver. Here's how it works. Your liver manufactures a protein called albumin. Albumin is the most abundant protein in your blood, and its main job is to act like a sponge, keeping fluid inside your blood vessels. It maintains what is called oncotic pressure. When your liver is so damaged that it can no longer produce enough albumin, the concentration of this protein in your blood drops. As a result, the sponge effect weakens and fluid begins to leak out of your capillaries and into the surrounding tissues, pooling in your legs and ankles due to gravity. I remember a client, a lovely woman from Scottsdale, Arizona, who came to me complaining of her heavy legs. Her doctors were focused on diuretics or water pills, which only addressed the symptom. When we looked deeper and supported her liver with dietary changes and targeted nutrients like choline and methionine, her albumin levels began to normalize, and the swelling in her ankles disappeared for the first time in years. This wasn't a water problem, it was a protein manufacturing problem originating in her liver. Finally, let's discuss a skin condition on the face that very few people would ever connect to their liver, rosacea. This is a condition that causes redness, flushing, and sometimes small pus-filled bumps on the central part of the face. It's typically treated by dermatologists with topical creams or antibiotics, which again, only manage the surface level symptoms. However, a growing body of research is showing a strong link between rosacea, gut health issues like small intestinal bacterial overgrowth, SIBO, and non-alcoholic fatty liver disease. Think of your liver, gut, and skin as being on a single interconnected axis. When your liver is fatty and inflamed, it can't detoxify properly, which increases the inflammatory load on your entire system. This inflammation can negatively impact the delicate balance of bacteria in your gut, contributing to conditions like SIBO. When your gut is inflamed and unhealthy, it can trigger an immune response that manifests on your skin as the redness and inflammation of rosacea. It's a chain reaction. The fire starts in the liver, spreads to the gut, and the smoke shows up on your face. So, if you've been battling rosacea for years with no lasting success, it might be time to stop looking at your face and start looking at your liver. Healing your liver through a low-carb diet, eliminating inflammatory foods, and supporting your gut with probiotics and fermented foods can often do more for your rosacea than any cream ever could. It's a perfect example of how the body works as a whole and how a problem in one area can send signals to a completely different part of your body. So let's take a breath and recap. We've journeyed through 10 distinct signs that are not just random quirks of aging. We've seen how tiny red spiders on your chest, red palms, a persistent itch you can't scratch, dark patches on your neck, easy bruising, and swollen ankles are not isolated events. They are part of a sophisticated language your body is using to communicate a deep internal struggle within its most industrious organ, your liver. We've debunked the myth that liver disease is only for alcoholics and uncovered the truth that for most seniors in America, the real danger is the sugar, the processed foods, and the sedentary lifestyle that leads to a buildup of fat in this vital organ. The key takeaway is this: your body is always talking to you. The question is, are you listening? These signs are not a death sentence. They are a wake-up call. They are an opportunity. Here is a valuable lesson that extends far beyond liver health. Your body has an innate, powerful, and profound capacity to heal itself. Your liver, more than almost any other organ, has a remarkable ability to regenerate It can literally regrow and rebuild itself, but only if you give it the right conditions. This isn't about embarking on a life of bitter restriction and deprivation. It is about embracing a life of wisdom. It's about consciously choosing the foods that build and heal over the foods that burden and harm. It's about empowering yourself with knowledge so you can take back control from a healthcare system that is often too quick to prescribe a pill for every ill, treating the smoke while ignoring the fire. Taking care of your liver is a profound act of self-respect. It's a commitment to your future, to having the energy and vitality to enjoy your grandchildren, to travel, to pursue your hobbies, and to live out your golden years with health and not in a state of chronic disease. Now, I want to hear from you. Your story and your journey are important. In the comments below, please tell me which of these 10 signs was the most surprising or eye-opening for you. I make it a point to read through the comments because that is how we learn from each other as a community. And if you found this information valuable today, if it has sparked a new understanding for you, please don't keep it to yourself. Think of 3 people in your life, a spouse, a sibling, a friend, who could benefit from this knowledge and share this with them. You could be giving them the one piece of information that sets them on a new path to health. Finally, if you haven't already, make sure to subscribe to this channel and click that little notification bell. I release new content every week aimed at giving you the straightforward, honest truth about your health and putting the power back in your hands. This is Dr. Eric Berg. Thank you so much for your time and attention. Stay healthy, and I will see you in the next video.